Hello, everyone. My name is Jennifer Stewart. I'm a counseling psychology PhD student at Fordham University, and I'll be presenting on my research today, which is a study called Understanding College Sexual Assault in the Me Too Era, a Phenomenological Inquiry. So first off, just to give you a little bit of background review on why maybe college, why this time. So 1 in 4 women and 1 in 16 men estimated will experience sexual assault at some time during their college career. It's likely that the number for men is actually higher due to lower reporting from men. Sexual assault and rape are actually the most frequently occurring violent crime on college campuses. These stats are a few years old. There haven't been many updated ones due to kind of restrictions around collecting these statistics in the most recent administration, but they haven't changed all too much. Only about 2 to 18% of survivors report their assaults to someone in power, which is a very low amount. And about 94% of women who experience rape experience PTSD symptoms within 2 weeks of their assault. Also, sexual assault leads to things like higher levels of depression, higher use of substances like drugs and alcohol, negative changes in self-worth, difficulty with sexual intimacy, negative impact on identity, which is particularly salient for college students who are in that emerging adult developmental phase where they're in the process of trying to establish their identity. This study was all done within the context of the Me Too movement, which many of you may have heard about, but just as a brief recap, was a movement kind of started snowballing after Harvey Weinstein accusations came out about him having sexually abused somebody when he was in power, or many people. But it really started by a woman named Tarana Burke years before that as a way to empower survivors of sexual assault to rally together and find support. So the purpose of this specific study was to better understand the experience of sexual assault survivors in the context of Me Too, including things like understanding their assault, understanding the recovery process, disclosure, who you did or didn't disclose to. This was a qualitative study using phenomenological methodology. And 16 cisgender female college students were part of the study. They were recruited through Facebook, on Facebook pages at various colleges throughout the United States. Used video chatting before 2020, before it was cool, to do a lot of the interviews, so we really could have a very diverse section of students from across the country. There was an interview that lasted anywhere from around 35 to 85 minutes. People spoke kind of quickly or shorter or longer. There was initial demographic survey just to get people's personal demographics, and then a follow-up interview a week later to both ethically check in on people. You know, I just spent an hour talking to you about your assault. How you doing? How you feeling? Trauma. And also if there was anything people thought of after they wanted to make sure I knew about. As well as I kept a researcher journal of my reactions, which is a pretty critical part of qualitative research to make sure that my biases weren't seeping in. After interviewing, I transcribed all of them, encoded them, and had some research assistants check my codes for validity. So 16 themes emerged through the interviews, 8 major themes, which are themes that are more salient, and 8 minor themes. So here are the 8 major themes. Survivors were drawn to advocacy work and directly supporting survivors after their assaults. People felt resilient and empowered after their assaults. And then some specifically about Me Too, about it encouraging reporting due to the community, about it bringing awareness and conversations about sexual assaults to campus. It increased empathy for other survivors. It decreased stigma and helped people name their assaults. And it also made people feel as if they were part of something bigger. Another big theme was having trauma-related symptoms as a result of an assault. I think everybody reported some sort of PTSD type symptom following their assault. So some quotes, there's loads of quotes. I just picked some to highlight. These were the ones I really liked. I think thinking about the decreasing stigma and helping name assault from Me Too, one of the women said, I think if it happened again to me today, I'd be like, yeah, this is assault. It's so obvious. And I think that's just a result of the Me Too movement. A lot of people reporting, you know, I was really afraid to call it this. I didn't think that my experience was severe enough to call it this, but having this national conversation about it really made me feel comfortable and better understand what happened. And it made me feel like this is okay, it happened to me because it's happened to so many people and I actually can feel part of a larger community. Another thing that was really inspiring was how resilient people were, feeling like, you know, if I got through this, I could get through anything else. Like, I want to make things better for other people. I want to learn from this experience. I want to help do my part. And then these are some trauma symptoms. Some of the minor themes, less salient, but still pretty prevalent in a lot of the interviews: self-blame, fearing of disclosure to parents due to victim blaming, which is also heavily tied into political leanings, and the politicalization of sexual assault, feeling a responsibility to report, feeling guilt about reporting and causing drama, especially on smaller campuses or people who were part of Greek life or athletics, not reporting because of Me Too, feeling that no one will believe them, feeling uncertain about what resources existed on campus for them to get help, feeling just like a statistic, like I'm just going to be one other person who's part of this, doesn't matter, and feeling really helped by other friends who had experienced this. Lastly, just some implications for what this means. So for us as clinicians, what does this mean? One thing it means is that it's very helpful for us to decrease stigma in the therapy room, right? It shows that having this Me Too conversation helps people feel more comfortable about talking about it. So kind of including sexual assault history or trauma history as part of intake interviews may open the door. If someone's not ready to talk about it right away, it at least opens the door for it to be talked about in the future. Doing specific trainings around sexual assault, considering the prevalence. Everyone, if you're doing clinical work, will have worked with a sexual assault survivor at some point, if you haven't already and not known, or if you have and have known, as well as learning appropriate responses to sexual assault disclosure, not overreacting, not underreacting, but making space for the person's reaction, and meeting survivors where they are, because every single person I spoke to was in a different spot. Also, some implications for universities, like universities need to do better about having accessible resources and knowledge for students to understand where they can get help and who is and isn't a mandated reporter. I think many students were like, I was afraid to report this because I didn't want it to get accidentally reported without my consent, which is almost like a parallel traumatization of getting your consent taken away. One big limitation of this study was the lack of racial diversity. All of my participants were white. A few thoughts about that. First off, I was recruiting on Facebook. I'm a white woman. You can see I'm a white woman on Facebook because my picture is there. And traditionally, white women report the most because they have the most trust and authority. So this could be a representation of the larger trends. I recruited at like so many diverse schools to really try and get a different collection. So I think in the future, if I were to do more of this study, I would try and recruit more specifically with BIPOC folks, as well as men and trans men and women. Excluded them for the sake of keeping external stressors out, but I think that they also experience sexual assault, and it would be helpful to also include their voices in this. And that's it. Happy to answer questions if people have them.
Gotcha. It looks like we have one here from David. It says, a very important topic to study. How would you like your findings to be into consideration for both future scientific studies and in general culture?
Yeah, I am a huge fan of using research to make action. Actually, I have been talking with the people from Me Too about using some of these findings to help affect policies or programs that they're rolling out. I would love to have them be more part of the conversation on university campuses who are notoriously not good at handling sexual assault. I had one person tell me, one of my participants said that her school moderated a conversation between her and her assailant, and that was their response to her reporting her assault, which, like, I see a lot of people's faces. If you're a therapist, you're like, why would you do that? So I'd love to get this more kind of involved in policy stuff, because there's a lot of good findings and getting to hear people's voices. A lot of studies about sexual assault have been quantitative, and this really was a nice way to get to hear people's voices and their thoughts on all of this.
Good, thank you. Any other questions?
I don't have a question. I just have a general comment. Jennifer, I appreciated that you addressed the racial sampling issues here. Definitely thinking from the intersectional perspective, right? Who privilege is not distributed equally among who feels able to report. So thank you for speaking to that so well.
Yeah, no problem. It's a huge part of it, right? Like, who can trust authority to say something? And how do we work to make it safe to be able for everyone to report? And that's probably a bigger question than any of us can individually tackle, but something to think about, because this is true for other crimes as well. I'm sure I only stick in the sexual assault realm.